I'm at Brooks Rehabilitation with the Director of Clinical Technology. This is Bob McIver. Thank you for having me.
Hey, thank you for coming.
And with everything going on around me here, what exactly does Brooks Rehabilitation do?
Brooks Rehabilitation provides rehabilitation services for patients after a stroke or spinal cord injury or a major traumatic event inside their lives to help them get back to independent function.
So then what are some of the most common conditions you treat here?
The most common we see here are patients after a stroke. We do also see neurologic conditions such as spinal cord injuries, brain injuries, Guillain-Barré's, acquired injuries, and some multiple medical traumas like multiple fractures, other major medical conditions such as that.
What would make Brooks Rehabilitation then stand out from other rehab centers in Florida?
A lot of it is our community program. So one thing that we offer to our patients is a post-rehabilitative way of care, so a system of care where we have patients have access to multiple different service lines after they've discharged from our hospital. One is our Neuro Recovery Center here, where they have access to over $2 million worth of technology. And technology really is a differentiator for us within this market as a whole.
Yeah, touch on that a little bit more, some of that cutting-edge technology that we're seeing here.
So one thing that I'm responsible here at Brooks is making sure that we stay cutting edge with all technology. So making sure we're bringing the latest and greatest to have access for all of our patients to be able to utilize within this center and within the inpatient and outpatient realm. So like I said, in this center alone, there's $2.5 million of robotics, of virtual reality. So just making sure we're always changing and making sure our members are part of that changing piece as well.
And how does it all work?
So we actually have a committee called our Innovative Clinical Technology Committee, which I lead up, and we bring new technology to a committee of nurses, executives, therapists, and patients as well, and we evaluate what is the best for our system of care. So where does it fit, how does it fit, and what's the biggest benefit for our patient, and then we decide to move forward if it meets all of those buckets.
Well, let's talk about some of the benefits. What have you been seeing here with the patients?
So one of the biggest ones we use here is called Cyberdyne. Cyberdyne is a robotic exoskeleton that uses intentional movement, so it uses the body's intentions to move to produce actual movements. And what we've seen with that is an increase in our patients, or a rapid increase in their recovery just based on using it, because it doesn't allow them to have compensatory movements, sort of like an Iron Man suit for lack of better terms.
Okay.
We've also seen a lot of virtual reality technology that really gets patients immersed into a different environment that allows them to move in ways that they can't in a normal environment, and it accentuates those movements and really gets them to that next level of care.
Yeah, I mean, just seeing it in action too, it is so amazing what science and technology has allowed us to do over the years. If somebody though is interested in learning a little bit more about Brooks Rehabilitation, what do you advise them to do?
They obviously can visit our website at brooksrehab.org. We have our Facebook page for our Neuro Recovery Center as well as Brooks Rehab as well. They also can just reach out through us and get a referral, and we can evaluate them and determine which technologies are best for them and what's the proper rehab course for them.
Right. Well, thank you so much for telling us all about it. It's amazing.
My pleasure. Thanks for coming again.
Of course. And if you'd like to see this segment again, just head to our website at